as of I think 5 or 6 years ago, we had a local hospital shut down in our county. Now the closest real healthcare system is 50 minutes away in La Crosse for most folks in our community. Such limited resources, which is true in a lot of communities, rural or otherwise, in terms of limited resources. But I think that's concerning to me.
And so I'm an immigrant, and what is kind of happening in parallel to this is, the president doing things to slow down immigration, using this as a opportunity. And obviously, it is hard to argue that an immigrant worker should stay here while Americans are losing their jobs. And suddenly it is they pause green cards. And my co-founder in my company, they were just waiting for the green card. It's going to come this summer. And now it is all up in the air. And their entire lives are unknown. In Turkey, the government started a fundraising campaign when this happened. So the situation in Turkey is probably going to be even worse. The unemployment rate here, I don't know, I guess it was 3-4%, and effectively it went, maybe 15% or 20% with the old people losing their jobs.
I'll go first. One of the biggest issues that I have with COVID-19, as things are stimulated, as things are to be rebound, the intentional investment in a population that was already living at the margin, but at the back of the margin. When parents come up to the school, those that are living in the marginal communities, when parents come up to the school with the children to get lunches or whatever that are being provided by the city, we're also giving the families food boxes. Great. And then for the seniors, we're giving foods for Meal on Wheels types of situation. And therefore, great. But you're still missing a huge segment of the population, especially the population I work with. 17 to 34-year-old African-American men, they're not being serviced, and there's no intentionality in servicing them.
The trauma of being there is one thing, but to now also be coming back to your community, to your family with a highly contagious virus that you don't know whether or not you have, just adds to the burden that people both on the island and their loved ones experience as a result of being detained there. And so that's something that I've been thinking about, is the ripple effect of trauma, but also the ripple effect now of this virus. When we talk about Rikers being a public health crisis, this is why. Nothing stays on the island, right? It always comes back to our neighborhoods, it comes back to our homes, it comes back to our communities. And to have to hold the burden of that as someone who's been detained there is just too much.